Mcgl from Mcgl. Very good. Nice to meet you.
Thank you very much.
Thank you very much. Yeah.
So His Excellency, I'm Cynthia of Momentum, Country and Global Leadership Program,
Yes.
implementing maternal, newborn and child health programs in Vihiga County. This is a USAID funded program. So during our early year of implementation, we are currently doing our year 4.
Yeah.
In 2023, in collaboration with NEST 360, did an assessment in the maternity unit and the newborn unit, and realized there was a gap to equip and ensure that we have quality equipment to support our mothers and the newborn babies. So the assessment was done, the report was shared, and from the report we were given some equipment that we needed to procure in relation to the space that is available in the maternity unit and the newborn unit to support our mothers and the bigger Vihiga County. So MCGL, through USAID funds, went ahead and procured the equipment. So as we speak, His Excellency, this is what we have procured, this is what has been delivered in place. And I want to confirm that the consignments are coming in by. So we are not yet through with delivering the equipment. So as we speak, this is where we are. These are assorted equipment to support both our mothers in labor room and in the newborn unit. Very essential equipment to promote life. The broad objective for MCGL is to reduce maternal and perinatal deaths. And the equipment will promote quality care for these mothers. Some of the equipment will be in the peripheral sites, but majority of the equipment are for this facility because it is our main referral facility for this county. So this is where we are, and MCGL is still committed to ensure that whatever is yet to be delivered will be delivered here. One of the equipment yet to be delivered is the theater lamp for our theater, maternity theater. The current one is not in such a very good shape. So we are committed to have it delivered soon.
Very good. Well, what I want to say that we are very grateful.
Thank you.
We have been with the MCGL for quite some time, and we really appreciate the work you have been doing for us, and particularly the support. And this is a very significant support you are making to us, because the issue of mothers and child care and maternal care is very important to us. And you coming in to become one of our key partners, I would say we are very grateful and we want to work together with you. And we look forward to exploring other venues within the health sector where we can work together and ensure that we provide quality healthcare system in the county.
Thank you so much.
So we're very grateful, and on my own behalf as the governor of this county and the leadership of the county and particularly the Department of Health, I must say we are doing a good job. And the MCGL, you have made us proud.
Thank you so much.
And we will continue working together.
Thank you.
Asante.
Asante.
Yeah.
So maybe you just show us a few of the...
It's just part of the equipment. So from here, these are oxygen concentrators. When our newborn babies are born, some of them are born with difficulties. And one of the essential needs for a newborn baby is oxygen. So these are concentrators and they are portable. So they can be taken to the various departments, maternity unit, newborn unit, even the pediatric unit to support our babies thrive because they need for oxygen. Then we have a phototherapy machine. Some of our newborn babies are normally born with complications, especially the ones that end up in the newborn unit. They are born small. Some of them develop jaundice. Initially, we had a phototherapy machine, but it was not in good shape. So as we speak, we brought on board 6 modern phototherapy machines. And
So what do these work? How are they used? So
It is,
that I understand.
you need to introduce yourself. You came in.
Governor knows.
We have been together for many years.
Okay, my name is Amina Baraka. I'm
Yeah.
the nursing services
Yeah.
in charge. Yeah, so this is a phototherapy machine. Those babies who turn yellow after they've been born, maybe because of physiological changes or because of conditions. So this is supposed to convert the bilirubin. What makes them yellow is basically the bilirubin that is too much in the system. So the light that is generated here is able to convert that bilirubin so that it reduces in the levels, and eventually the baby just gets recover from the whole condition after being on this but it is regulated. There is an amount depending on the amount of bilirubin in the blood. Yeah, so
one equipment.
No, I was here want to know what this is.
okay, so here we have the cardiac monitor. Oh, sorry, we have the CTG machine. This one is basically able to detect the fetus heart rate in the abdomen when the baby is still in. So instead of us using the phone call that we normally do, it has straps and the probes. So you just tie around the mother's abdomen, and you are able to hear the sound and count the rate. It is also able to print. So it will produce just like an ultrasound. You attach it and it prints. So you don't need to, it will ease the work, and it's more, it is more sensitive. You are able to feel even for the mothers with very big abdomen that it may be very difficult to get on a fetoscope. This one you are able to feel it.
I think, Your Excellency, it comes in handy because we have always had challenges where a mother says, walinipima wakaniambia mtoto ako sawa, but she ends up delivering a child or a baby who is already dead. So it brings up so many issues. So I think this one gives you a level of accuracy that this is the condition of the baby in utero before they are even born. Yeah.
So this is basically a fluid pump. For small babies, it's very difficult sometimes to manually calculate the amount of fluid you want to give intravenously. So this one basically has the readings. It's controlled. So once the doctor prescribes, you just insert here and set your readings, and it will release the fluids into the baby according to the prescription of the doctor. So there are no errors that you are trying to regulate, you regulated less or more. So that is what the fluid pump is doing. Then we have the diathermy machine somewhere. It's already in theater.
Okay, sir.
This is basically for our resource center. We'll be using it, just an LCD for projecting. So it will be enhancing the continuous medical education amongst the healthcare providers here. So every week we normally have CMEs. So this will be supporting, and we'll put it fixed there so that it also reduces breakages and losses. Then behind me, we have the vital signs monitors. These ones we were given 3 with 1 cardiac monitor.
Thank you so much for your collaboration.
Thank you for the
allowing
support.
us to work in Vihiga County.
You are allowed for as long as we have the partnership.
Thank you so
And
much.
we want the partnership to last longer.
Thank you so much.
Thank you.
Thank you.
Yeah.
And just to add on, His Excellency, through Usaid we had been asked to close up by September.
Yeah.
But I'm happy because of your intervention.
Yes, sir, you talked to them.
I confirm that you've been given an extension for the next 18 months.
Excellent. Thank you. Thank you. Thank you.
Yes.
Yeah, maybe 1 minute, Your Excellency, we go up here.
We are also supporting, since it's a project and one time will come to an end, we're looking at what are some of the sustainable measures we're putting in place to ensure that mentorship and capacity building continues.
Yeah.
So through the support of, again, the county and the facility leadership, we're given some space up here to change it into a skills lab.
Yes.
So we managed to procure a few seats, a table, and a cabinet. And previously we had procured mannequins. So as we speak, there are sessions going on, and we are planning to make it a standard skills lab, so that even as we go, the healthcare workers across the county can continue learning. So you can just pass by for 1 minute. Thank you.
For our newborn, and we are going through the skills. So we had begun straight from the mother, coming to the resuscitation table. So coming to the resuscitating table, so we're just giving an ideal setup in how we're supposed to go through it. So we had gone, initially we started from airway, and we talked about airways.
Yeah, for the training, and besides that, an additional equipment, which is very key for us for quality services. So now our healthcare workers don't need to go all the way to other counties for the services. We really appreciate that.
And you have seen our plaza is taking shape. So there will be more space, and we will make more prayers for more equipment from all partners. And we must say we are most grateful for the work that we're doing as we train our staff. Thank you. Your Excellency.
Thank you for the good job you are doing and the commitment. This is a serious commitment you have. Healthcare system actually is a commitment because you do more than what you are compensated in doing. So we appreciate as a leadership of this county for what you are doing. We may not say it, but I can tell you we appreciate what you are doing. So we will create enabling environment for you to lead. And of course, the welfare issues, we have not forgotten. We look at it. Thank you. And I'm happy that very soon we shall be completing our hospital plaza, where we have a more elaborate facilities for capacity building. So this to me is very important. It's one thing to give equipment, but if you can't train our staff to use those equipment, then it becomes a problem. So I think you are adopting a holistic approach to providing services, from capacity building to equipment, and to ensuring that the facilities required are available. So we want to say we are very grateful, and that's why I said we want to have a long-term partnership with Mcgl so that we can continue doing this. And as a governor, I'll always engage your bosses at the top there so that I make sure that, where there's a problem, we are able to sort it out and we continue.